mitigation pending, and we have 21 negatives. So we expect to see these cases grow, and we also expect to see more proof of community spread. We've thought that it is here all along from what we're seeing around the United States. From the delays in testing, all indications are that we do have community spread, but this is our first case that meets that definition. Presently, the patient is hospitalized under appropriate care at Mercy Medical Center. The local health department, Stark County, alongside Canton City Health Department, are both investigating a large number of contacts. In Cuyahoga, I'm going to give you a quick update on that as well, and then I'll talk to you about community spread. But in Cuyahoga, we still have 3 people in isolation. They were all at home, 2 males and 1 female. They are being monitored. There's an extensive contact investigation underway, over 100 people, and you'll be learning more about that in the days to come. We also know that we have 6 healthcare workers at university hospitals, and then we have at Mercy some suspected hospital workers. So these are all the things we've been talking about all along. I want to talk again. I know yesterday I gave an explanation of the pandemic curve, but I feel it's important as we all try to get our heads around the spread of this disease, myself included. I will say, driving to work today, I think we're all, as citizens, coming into an increasing dawning of the situation. It's hard to get our hands around that. We know we're going to have a couple tough months ahead. We know this disease is spreading in the United States, but we will get to the other side of that. I think it's really important to say that. When I talk about what we can expect, we've got some hard months with social disruptions and things that we'll be doing increasingly to prevent the spread of this disease. But we know when we take these actions, they make a difference. So I'd like to show you why. So again, I'll step away from the microphone. So this is a classic pandemic curve, as we talked about. And we plan for these pandemics, but this is that once in 50 years situation. I know the World Health Organization today just declared the words pandemic. And we prepare for this. This is what our hospitals and our businesses and our schools and certainly our health departments are working on. And it's very important, the strategies we've been taking all along are to decrease the amount of people affected and delay the onset and kind of slow the spread. And why this is important is this is China, which, as we know, overwhelmed the healthcare system. We now know in Italy, as I said before, there were 9 cases 2 weeks ago, and now in Italy, as we learned last night, there aren't enough ventilators to go around for patients. So everything we're doing in the United States, and certainly here in Ohio, is to try to not overwhelm our healthcare system. As amazing as our healthcare system is, there are techniques we have to take. So there is a level, if I were to draw a line, there's a threshold here. This is where our healthcare system becomes overwhelmed, where someone asked yesterday, our supply of ventilators, our supply of ECMO. Of course, we have to worry about our healthcare workers. Now we're hearing that healthcare workers are out. That puts a stress on the healthcare system. So everything the governor is doing, and you'll see other states taking these actions as well day by day, is to keep us in this blue curve. And if we can stay below this threshold, we can try to not overwhelm our healthcare system. And so these strategies, again, there are phases to a pandemic, and everything from the border actions that were taken, unprecedented, not taken in 50 years, to the kind of guidance we've been giving you every day, to some of the new guidance we're going to issue today, some of the steps that citizens in Ohio will see in the days to come. We're really going through these stages, so they're predictably unpredictable. We didn't know that Stark County, Canton, Cuyahoga would be where the first cases would be, but we can expect to see this all over Ohio, and that's the work we're doing now, following our plan, executing our plan. So community spread is a big stage, it's a game changer. Community spread is the CDC last night issued new guidelines, and we're using those guidelines, and you're going to see us take more aggressive actions now to stay below that line I showed you. And again, all the states are in the same boat. They're kind of facing it. They're making these moves, so it's almost like a little bit of inching forward as you're seeing across the United States, but everything is moving in that direction. And so please know, as we make the moves we make, we're doing it to protect Ohioans and also make sure our healthcare system can handle what it needs to do to keep us healthy. And I'll talk more facts.
Thanks, Amy. So this was not unexpected. We felt that this was coming, but it has now come. And so we're at a different stage, a different chapter of working our way through this. I want to cover a number of different areas. Let me start with our K through 12 schools. The Lieutenant Governor was on a call yesterday with the superintendent, and he raised a question. So I thought that we're certainly not announcing anything new on K through 12. We may at some point have to close the schools. We've said that, but we're certainly not there at this point. But I want to assure people who are in education, the principals and the superintendents, school boards, parents, that some of the requirements, if we come to that and the schools have to be closed, we will certainly work with the schools to waive requirements. We will work with the state legislature to do that. For example, the testing requirement. This particular superintendent was concerned about how do we do the testing requirement. Look, the legislature and the governor will certainly be involved in waiving some of those requirements if we reach that point. So not announcing anything today. We just want all our educators to know, look, we're going to work with you if we come to that point and have to do that. We're all in this together, and some of the requirements that are out there will simply have to be put aside, until the next year. So I want to talk about that. As we have seen, our nursing homes and the people who reside in nursing homes are particularly vulnerable. We've seen this in Washington State, the tragedies that you're seeing occur in nursing homes there. These are individuals who, most of them are they're elderly, most of them, not all, but most of them are elderly. They also, many of them are certainly medically fragile. So the essential function of government is to do everything that we can to protect the people. We have an obligation to the people who are in these nursing homes. We have an obligation to their families. They are particularly vulnerable. And so we will be I'll make an announcement in a moment, but I want to again ask Dr. Acton to just kind of address that nursing home population.
Thank you, sir. Again, we now know some of the statistics, as I said yesterday, that the fatality rate with this disease increases with age. And we know our senior citizens are most at risk. I said a startling statistic, I think, to some of us in the room, that even of 40 to 50-year-olds, if you contract this disease, 1 out of 250 die from it. When it gets to seniors contracting this up in the 80s, that number can be 15% of that population. One of the tricky things about community spread, once we suspect it's amongst us, but by definition, once we see 2 cases of community spread, you can assume that 1% of the population is infected. And that leads to a whole host of other measures. But it is the elderly we're most concerned about. Obviously you've watched what's happened in Washington. And so I know the governor there just has taken more steps, and that's the kind of thing we're looking to do, again, with love, and judgment for our most vulnerable.
So Dr. Acton will be issuing later today an order in regard to the nursing homes in the state of Ohio. as well as assisted living facilities, to limit visitation to one person per day. One person per day. We are also ordering that the nursing homes set up a log, if they don't already have one, who's in, who's out, that everyone who enters must sign the log. In addition to that, anyone who enters, this would include staff, this would include vendors, this would include the one visitor per day per individual who resides there. They would have to be their temperature taken and an assessment made of their health and basic questions asked of that individual. So this is the next step that we felt we needed to take to protect this vulnerable population. The step after that would be to ban all visitors. We're not there yet. And this is always a balance, quite candidly. People who are in this situation enjoy visitors, a loved one, spouse, a child, and that socialization is important. So we're trying to balance this, but we also know this is a particularly vulnerable population, and we have to take rather dramatic steps to do all we can to protect them. Let me move on. We are not issuing today, but I'm going to announce that we will be shortly issuing rules. Dr. Acton will, in the future, next several days, sign an order in regard to mass gatherings in the state of Ohio. Let me just, again, reiterate what every expert has told us. And that is there is a risk in any kind of mass gatherings. The bigger the gathering, the more the risk. The closer you are in proximity to the other people, the bigger the risk. So everyone needs to make, first of all, needs to protect themselves by making those judgments. And it seems to me, I was at the call center today, and a lot of calls coming in. And calls coming in from people throughout the state of Ohio with legitimate questions. And I turned to one of the, as I was talking to one of the, our health experts who are on the phone, have been working, they've been doing a phenomenal job, by the way. But I said to one of them, look, I think what you need to tell them when they come in, when they call you and say, should I do this, or should I do that, or should I attend that event, or should I travel here, or should I do that? It seems to me the question that they have to ask themselves is simply this: is it necessary? Is this something that has to take place? Do I have to do this? And if the answer comes back no, then probably the answer of doing it is no. And I just think that's good guidance for people around the state of Ohio. The reason that we're doing the things that we are doing, the reason we're doing the things that we're doing is we have the potential of becoming Italy. We have the potential of what you're seeing in Italy. And you've seen how much things have changed dramatically in a two-week period. So the potential is there. We know that as a possible outcome. What we want to do is take action now to do everything that we can to avoid that. And that is why we are ordering the different things we are ordering. We know the situation is going to get worse before it gets better. We know it's going to be bad. The question is, how bad is it going to be? And we have within ourselves, each one of us, in the decisions we make every single day, we have the ability to determine that outcome. And that outcome has not been determined yet. It is within our hands to determine what that outcome is going to be. Returning to the order that is not drafted yet, but we will be issuing, and I just wanted to give everyone a heads up that we will be issuing an order on mass gatherings. One of the things that we have found in discussions, and this is very understandable, is that different organizations, quite candidly, need an order from the government. There are certain reasons that the lawyers could go into, and although I'm a lawyer, I'm not playing lawyer today. So, but it's been clear in talking to different groups, different organizations, that it's better for us to make their life easier in the sense of issuing an order. And we are done with that, and then they can take that order, and they've got an order from the government telling them that what they have to do, what they cannot do. So that order will be forthcoming. Let me just, before we open it up, say what is occurring and what we are seeing occur is predictable. It's been predictable in the sense of the experts that we have been consulting, and we continue to consult these experts. We have the ability to control risk. Everything about life involves a risk. What we should not be doing is to take unnecessary risk. When we can avoid taking risk, we should do that. Each one of us is having to change how we live. And as Dr. Acton has said, we will get through this. We will get through this. Ohioans are resilient people. We're tough people. We will get through this. And the sun will come up in the morning, but it's going to get darker before that sun starts coming back up again. And the goal is to minimize deaths and flatten that curve that Dr. Acton was talking about. Each one of us has to change what we're doing. And for me and for John Husted, shaking hands and going to meetings and seeing people and running all over the state is what we do. But we are stopping it. We have to change what we are doing. We have to lead by example. So we pretty much cleared our schedules. We are focused for two reasons. One, we want to set a good example. One, we don't want to have the exposure. Also, we have to be here to make these decisions. And I have to be in our command area and be involved in the making of these decisions. But again, none of this is fun. But each one of us, I think, has to take responsibility. We are doing more in our office in regard to teleconferencing. Meetings that might have been done in person, we're trying, particularly when we're bringing people from outside the area in, or they're large meetings, we're trying to do those by phone. We're trying to do those by teleconference. And we have instructed every one member of the cabinet to do the same thing. We've also instructed members of the cabinet to work with their people who work under them in regard to who is it essential that they actually physically be here, and who can work from home. We have a meeting scheduled with the cabinet tomorrow, and we will get into more details with each member of the cabinet at that point. So happy to open it up for questions. And
Governor, can you give us a little more context on this mass gathering?
Look, let me just say, yeah, sure. What we said yesterday, at a minimum, the order will include what we said yesterday about mass gatherings. That will become an order. So, you know, the teams that are looking at this, and I want to say that I want to congratulate the Mid-American Conference. They came right up. I want to congratulate the Ohio Athletic Association. Didn't hesitate, did it right away. Thank you. You know, look, and that's tough. And I think the toughest thing yesterday was, you know, the idea that high school athletes, you know, who have trained, will not be able to play, compete in front of their fans, in front of their schoolmates. We did try to modify it and make it so that there, the families could, immediate families could come, the event can go on, the competition will go on, but it's tough. But I just congratulate, the Ohio Athletic Association, the Mid-American Conference. I know there's others who have made decisions based on what we said yesterday, and I thank them very, very much for that. For the rest of them, there will simply be an order, and that will be taken care of in the next 24 or 36 hours, something like that.
Cover outdoor events, Governor, will that cover outdoors?
Well, with the news, that is still a work in progress, candidly. We have a change today, and the change is, as you've heard Dr. Acton describe it, the community spread takes us into a different area. And so we'll have more of that tomorrow.
Governor, you mentioned
Does this mean that, just to be really clear, does this mean that the NCAA games in Dayton and Cleveland will not be held with spectators?
We'll have an order, yes.
Governor, this morning you mentioned prisons. Does that exist already in an order, the restrictions that are taking place there?
I'm sorry, I didn't hear the first part.
This morning you talked about prisons and restrictions that are taking place there. Does that exist in an order?
That's an executive order, but I simply, the director and I talked about it, and she did it. So we don't have to do that because that's under the executive branch of government. When we get outside the executive branch of government, we get into the private sector or we get into other associations, then obviously we have to invoke the law to do that. But that can occur directly with the director and myself, that discussion. And she has certainly led on that, and the same thing with DYS.
Governor, does the state have enough testing kits, and are the testing kits, do they have everything that they need in order to be?
Yeah, I'm going to let Dr. Acton take the tough questions.
Thanks, sir. So I did go over the testing guidelines a few times. Our labs are up and running. They're doing a couple batches a day at this point. We did receive reagent enough. I had originally said 300 to 400. There was a change made this week, which allowed us to do 2 specimens from one patient having 2 specimens, to put those 2 specimens together and run 1 test, which is allowing us to do even more tests. That allows us to have extra tests. But there is a limit. We are in the queue for more reagent. But testing it has been a limiting factor in how quickly we can describe what is going on, but from our clinical judgment and from the judgment of our epidemiologists and what we see happening around the world, we can infer quite a bit as well. And we are also doing some sentinel testing, as I mentioned yesterday, trying to look for clusters, places that might be, maybe I mentioned like a nursing home that had a rash of respiratory disease, but they tested negative for flu. We're going after some hot spots so that we can get a better handle on community spread. But I do want Ohioans to really come to terms with the fact that we do have this virus amongst us here in Ohio. And that's why we're asking everyone, again, coronavirus.ohio.gov. We're trying to give everyone the best guidance, but in the end, as I said, we're all dawning into the awareness that life as we know it is going to be disrupted and change for a period. We're also going to all pull together and take actions. And again, the action I take by being careful myself keeps 2 to 3 other people, and those it's logarithmic. And so the actions we're all taking now really do make a difference. What I do affects your grandma. And that's how the spread of disease works. And the more of us take these steps, it won't be perfect. Just like they couldn't perfectly, hermetically seal off the United States, anything I execute will be imperfect. It won't get every single citizen. We're not going to put every single citizen in lockdown, right? They're not even doing that in Italy, right? But the more we do, because of herd, the more people, that affects that curve. Everything we do keeps that shrunk, and it stretches it out. And the more it flattens it, the more we can manage and ride that out. And where you see the difficult decisions, again, that some countries are facing, it is because it's overwhelming their healthcare system, in addition to the tragedy of the loss of life.
Let me just add something if I could. Look, I talk to people every day, And I think this is difficult for people. It's difficult because they don't see it out there. But we know what's coming. We know it's around the corner. In fact, we know it's already here. And we have the experience of what has happened in Italy. We have the experience of what has happened in China. We have the experience of other pandemics. And so while it's difficult for people to kind of get it, and I understand it, I have to keep telling myself, look, this is different. Everything looks the same, but it's really not. I just would say to my fellow Ohioans that it is different. We should not panic. We should not get upset. We just need to take rational actions to protect not only yourself, but your loved ones. I was talking to a friend of mine last night whose wife has some serious health problems, and she is self-quarantined. She's made the decision. Her doctor called her up. Didn't even wait for her to call. He called her up and says, "You need to self-quarantine." So this is where everyone needs to take two things. They need to take responsibility for yourself, because a lot of people are depending on you, and a lot of people love you. But at the same time, what you do, not only it impacts you, but it may be a total stranger. And so you getting sick, you getting exposed, could have an impact on people you don't even know. So this is an opportunity for us to come together as Ohioans. It's an opportunity for us to do what I have seen Ohioans do in floods and tornadoes and other calamities and mass shootings and other horrible things. And every time I see that happen in Ohio and I'm there, I see Ohioans who are coming together. And so this is the time to come together. Maybe not physically come together, come together emotionally, and do what you need to do to protect your neighbor and to protect yourself and to protect your family. It is a time for us to look forward and accept what the reality is and accept what the experts are telling us, even though we're not seeing it. And Dr. Acton's example is Italy. 2-week period of time, fundamental, dramatic difference from something that most people couldn't see at all until basic lockdown of the country. So it comes fast. We got to level it out as much as we can.
Governor, what you want Ohioans know today about outdoor events? Baseball season is upon us. Reds
Look,
opening day. Your favorite day?
I touched upon that a moment ago, and I said the order that we will issue certainly will include the sports that we talked about yesterday, but we have to look at everything now in regard to the fact that we have the community spread. We have confirmed it is here. We turned a new chapter. We have to look at things differently. Our panel of experts, we put out the names of those experts. We are consulting them. We're consulting other people to make decisions every single day. You have to bear with me one day at a time. These are the decisions that we can make today. We want the decisions to be logical. We want them to be well thought out, but we want them to be timely. So we've made these decisions we've announced today, and we'll be back tomorrow at 2 o'clock. So who else?
What about travel bans in the state? Is there any?
I'm sorry?
What about travel bans in the state? Is there any talk about any kind of travel bans right now?
Look, I would say at least for this point that people, again, need to think about this. And I'm not the doctor. People should consult their own doctor. But if you're 80 years old and you have a trip planned to L.A., I'm not sure it's an air flight. I'm not sure I would be getting on that plane. I think people just have to make their own judgment about travel. And I would get back again to what I told our health expert worker who was on the phone. I said, you need to tell people, ask themselves, is this necessary? Look, if you're going to the funeral of your mother, you may say, yeah, I need to be there. I mean, we can't impose ourselves on these individual decisions. But if it's a trip that can be postponed for a few months, or a trip that you don't really have to take, I probably wouldn't be taking. I mean, it is all about proximity to others. It is all about being sneezed on, and I'm starting to get out of my area here, but it's all about that proximity and being close together. And look, you know, my experience on, I've flown a lot, and you know, you're in that middle seat, and think about it. I mean, you can't get, you know, you can't get out, and you know, yeah. We'll go from page.
Conventions and trade shows, or do you have a size threshold on the size of gathering that would be?
Look, I would recommend anybody that's bringing, and we'll come back later to address that, as I said. But I would recommend, based on what the experts tell us, is any big gathering of people should not, you know, really should not occur.
What about
Or
church?
the day by day.
Look, we're dealing with two things here. You're dealing with what the government, what we are going to say people have to do, and you're dealing with what people should do. Those are two different things. If you're asking me right now, you know, what should people do, I would say that chicken dinner you're going to tonight, don't go. I mean, you know, a big gathering of people, I don't know why you would do it, and particularly if you're elderly, and particularly if you have, you know, an individual health problem. I mean, these are individual decisions, so we should not look at this that the state's going to make every decision for people. Most decisions that's going to impact their safety is going to be made by the individuals. What we have the obligation to do is to bring the best professionals we can, get that information out every single day, and sometimes more than once a day, to the people of Ohio, and the people of Ohio to make those individual decisions. Now, in some cases, we're issuing orders, and we're issuing things because it affects a lot of different people, and we feel that this is in part of the essential function in an emergency of government is to issue the orders. So we're going to take them one at a time. I'm not going to speculate on what we're going to do next, but I would just say that people need to make their own decisions and ask the question, is this trip necessary? Is this gathering necessary? And people, you know, make their own decision. It just needs to be a calculated. The only thing I can request is it be an informed decision.
Governor, how are we doing on funding, and how are these tests being funded?
Amy?
So some of the tests are paid for by insurance, and I know Medicaid is also doing that. Director Corcoran could speak to that. You know, the tests are coming to our lab, and we do not charge. You know, we're just going to run the tests. So, you know, I defer to that. And I think what the governor is saying is, as we look at the types of mitigation strategies, that was the second chart there, the types of things you take when there's community spread, you have to give us a little bit of time because we're weighing these policy decisions. We want to make the right policies for Ohio. So, you know, we're working on those in detail, learning from what others have done as well. And as we have those available, we will roll those out.
How close are we in terms of what you're hearing from the CDC or WHO about a vaccine? How far away are we from the vaccine for this? Are we years away? Are we months away? How long do we have to wait for this?
So, you know, we will need to get a vaccine. Obviously, this is a virus of which we don't have immunity. And they got to trials. They're saying they're getting to trials in 3 months from the start. That's what Dr. Fauci said at NIH. But it might take up to a year to a year and a half till that's in full production. And so another promising hope, again, I'm waiting as all my colleagues to see if any of our existing antivirals that are on the market. Tamiflu is an example of an antiviral that you take after you already have the flu to decrease the impact, decrease the shedding. And there are some antivirals out there that are being tested against this particular coronavirus. But right now, the reason we have to do what are called non-pharmacologic interventions, to be scientific about it, the things we're doing now, all these policies and actions we're all going to take as a state together, are the best things we can do. This has been studied, and I can tell you, I've talked personally just this morning to the people who authored these interventions and the recommendations. So he said to me that your state is doing everything right. This is where you need to be now. And we are going to be, you know, we're taking this seriously, and we're being very aggressive in Ohio, and we'll continue to do that.
Dr. Eichmann, to what extent are the state's current testing guidelines for the coronavirus shaped by the amount of tests available? I mean, if there were more tests,
Yes.
would we be broadening those guidelines?
Yes, and I've been quite frank with you about that. We are limited by the amount of testing. I've said we have a limited number. That said, we have, been working at full capacity. We received 1 kit from the CDC, but I've been told we're in queue for more. I am hearing that there are issues about reagents out there, so I'm listening and learning as much as you are. So on the public side, 1 kit, which is a bunch of 3 liquids that you use to calibrate the machines, is enough for 1,000 runs. You lose, each time you do a run, you lose a control. So that ended up being 850. Before we were having 2 to 3 specimens per patient, now we're getting to 1. So I would estimate that we're above that 300 to 400 runs to people that we will test, but I can't tell you exactly how many we'll get out of those reagents. There are, accordingly, private labs, Quest and LabCorp, that have said they're in production. I realize that they have limited capacity, and I think we are maximizing, and we have a 3-pronged strategy, which I described in an earlier thing. We're prioritizing folks who are most at risk: elderly, immunocompromised, people with pre-existing health conditions, hospitals. And I'd really like to give Dr. Thomas a second to explain to you from the hospitals, because what we're finding is that most people will end up being tested at the hospital. Also, our hospitals are, it's an amazing thing in Ohio. I'm so grateful. All the hospital systems are working together collaboratively. They're working on things like drive-up testing. They're going to be working on a lot of innovative ways to have parts of their hospitals just for patients separated. You're going to hear a lot of things, and I think maybe I could ask Dr. Thomas to share a little bit about what Ohio State is doing in other hospitals.
Good afternoon. My name is Andy Thomas. I'm Chief Clinical Officer at the OSU Wexner Medical Center. Just a couple of comments about what the governor and Dr. Acton have been saying. The medical advisory group that the governor's office pulled together represents the physicians and hospitals from across the state, have been discussing a lot of these issues routinely, providing feedback to the governor multiple times over the past week and a half. And one of the reasons why we are so interested in and actually supportive of a lot of the things the state of Ohio is doing is exactly what Dr. Acton described on the chart. If we don't do things in Ohio to both decrease the pace of this infection as well as the intensity of the infection in the community, some of our communities will end up being overwhelmed by this. Not every hospital in Ohio has the capacity with the types of rooms that you need, the equipment that you need to manage these patients. So many of our larger hospitals will be relied upon regionally to take these patients. And the capacity to take those, most of our hospitals, though, especially our larger hospitals, run at high capacity to begin with. So if this becomes a rapid escalation, as you see in the yellow curve, this is something that could overwhelm our hospitals, will lead to things like cancellation of elective surgeries, cancellations of other treatments in order to make room for these patients. And at some point, the system just can't absorb that many critically ill patients anymore. So even though it's good news that only 5% of patients that get this infection end up in the intensive care unit, based on the evidence that we've seen from around the world, there is still a maximum limitation of what the system can take at any one time. But if we can slow the slope of that infection and have it look more like the blue curve, that's a type of insult to the system, essentially, that we are able to absorb, that providers, the equipment, the space in our facilities will be able to take care of. So we're very, very excited that the state of Ohio is getting out ahead of this and not being responsive, but being proactive.
Governor, when it comes to the mass gatherings, can you clarify the threshold?
No.
1,000 people, 100 people, so people
No.
out there understand that they can cancel events.
Look, Ohioans have to understand what the facts are. And the facts are that any gathering of people in close proximity to each other is dangerous. They should make their own decision. Both those people who are holding the event need to be responsible and cancel the event. If that event is not canceled and you were planning on going, you need to measure that risk, and you need to ask yourself questions if you've been to that event before, how close in proximity am I to the people who are there? How long are we together? What is the ability to move away from other people? You know, whatever order we issue, and we will issue an order, it can't cover every circumstance. And people are going to have, I think if people, we're operating under the assumption that if people understand the facts and really understand the facts and really understand how dangerous this is, logical people will make logical decisions. And that is much more important than how far a order we issue, because there's a limit to what government can do. And people have to be responsible. And people should not look at any order. Let's take the nursing home order we put out today. You're sick. Your mother's in the nursing home. Could you maybe get through and pass it and didn't have a fever and walk in there and get by? Yeah, maybe, but should you do it? Not if you love your mother. I mean, people are going to have to take responsibility, and it's our, look, I understand how hard this is because we see no changes out there in people, but the world has changed for Ohioans, and people need to take that responsibility. So yeah, we will have an order within the next several days in regard to mass meetings, but the most important thing is for people to ask themselves, should I go to that event? Is it important? Can it be postponed? We're not asking people to change their lives for the rest of their lives. What we're asking them to do is change for a period of time. We do not know how long that period of time is. It is 2 months, we don't know. But it's not forever. And, you know, most people make rational decisions and they do things for a while that they don't want to do if the outcome is out there that they want to get to. And it seems to me the outcome we all want to get to is be alive and be healthy when we get there. And that's what people have to look at. John?
Look, this is the same advice we give our own families. The advice that the governor is giving the people of Ohio is the same advice I give my mom and dad and my kids and my wife and my neighbors and everybody that we come in contact to. And we're just trying to make sure that they have the same information that we have when we come to these conclusions.
Is there discussion of any economic assistance or loans for those businesses that are depending on these events, the small businesses that depend on the multiplier effect, or the hourly workers who don't have paid sick leave?
All those things have to be looked at.
Governor, what's your advice on
Andy?
the legislature? Do you have any message to the legislature? Should the State House still be operating?
As we go through this, I think it is likely that we will need additional legislation in maybe specific areas, and we're looking at that, and if we will keep the leaders of the legislature informed, and we will move forward with them. Again, I guess, you know, everybody's got to make a judgment call. If you're talking about in the atrium having 300 people there who are coming from some trade association, yeah, that's a no-brainer. Don't do it. Now, if we're talking about, you know, a legislative hearing where there can be some space with people, not everybody's in crowded together, you know, well, that's not an irrational judgment on that part. Look, I went over to our call center. When I walked out of there, I came back to my team and said, you got to move them. They're too close together. Everybody's crunched in together. You're going to get somebody sick in there. So, you know, we all do things and we adjust and we see things that we say, oh, hey, we shouldn't really be doing that. And we're not perfect. And nobody's perfect. And, you know, you go do things as like a lot of things in life. You go do something and say, why did I do that? So we want people to think about before they go do that. And like I said, we're all subject to that. And we all are kind of working through this. Look, you know, Fran and I have 24 grandkids. We have seven surviving children. You know, look, I sent an email out 2 days ago to them, and I'm getting responses back. And I'm saying, well, you know, look, you got to calculate that. You know, you're getting on a flight and you're 25. That's different than if you're getting on a flight and you're 85, seems to me. But even for that 85-year-old, maybe that's the right decision. It just depends on what all the facts are. but you got to weigh it and weigh out and what are the risks doing something else, you know? I looked at, you know, you got an 18-year-old, let's say, and they got a ticket to fly someplace or they're going to drive. Well, I don't know, you know. There's a risk to both, right? 18-year-old driving a car. So you got to make those decisions. You got to go through that assessment. And they're not easy, and sometimes there's no right or wrong answer. It's just we all do things to calculate a risk. And the message to the people of the state of Ohio today is there is a new, big, huge risk in your life. You never thought it was coming. I never thought it was coming, but it is here. And you better calculate that risk just like you calculate everything else you do in your life. So,
Governor, now that we have community spread, should any more precautions be made for the upcoming primary and early voting that's already underway?
well, look, I think it's, again, we'll go back to basics. You know, I think that people should think about trying to vote, whether it's on election day or whether it is before election day at a time when there's a smaller crowd. You know, mid-afternoon. I don't want everybody to rush to mid-afternoon, but that's, I can tell you as someone who has worked the polls for 13 hours, that about 2:30, there is nobody there usually. So then it kicks up about 4 o'clock. You get kind of bored if you're standing there shaking hands. But, you know, so just people just adjust and try to figure out how I can avoid a mass group of people who are being pushed together. But look, this election's going to go on. People should vote. You know, the Secretary of State has been taking actions that are appropriate. We move forward. And look,
Time to vote by mail.
For Dr. Acton,
still have time to vote by mail, as the ex-Secretary of State just said.
Dr. Acton, given the number that you said, that it's assumed that there's 1% of the population that has this, are really enough people being tested? I mean, right now it seems like it's about 50, give or take. That seems like a really comparatively low number, given 1% of Ohio's population.
We're testing the highest risk because we're testing based on the resources we have. But I can tell you there will be a time in this. The earlier chart I had with the stages, up to 40% of the population could eventually get this. Remember, most people will get it. It will be a really rough flu-like experience. There'll be some people who get it mild, like a cold. And it's our most at-risk people that we really have to catch on soon. There'll actually be a time where, you know, we won't even be doing all the contact tracing we're doing because it's so spread amongst us. You know, that labor, it will become impossible to trace every person and the 100 people they talk to and the 100 people. Eventually, sometimes we stop testing. And eventually, on the other side of all this, it might be part of a routine respiratory panel. So there is a progression of testing. We're using testing now to detect community spread. We can pretty much assume community spread at this point. We're still trying to detect our most at-risk places because in some communities, they might take actions more specific to that situation in that community. Then Cleveland might do something a little different than Cincy, and those local health departments are on the front lines, and they'll be leading that with their mayors and public officials and their hospitals. But there's certain things that we can do as a state that help those folks at the local level, and those are the actions that we're taking.
When do you expect hospitals to roll out these drive-through testing centers?
I
What was the
believe,
question?
When do you expect hospitals to roll out like drive-through testing centers? How far away are we from that? I think you do.
I can comment on that. In discussing with leaders of other hospitals across the state, multiple hospitals are actually doing testing. Certainly for patients that are inpatients in the ICU or in the regular hospital, routine hospital, we are testing those patients and sending those to Dr. Acton's lab, the Ohio Department of Health. We get the quicker turnaround time, and those are very clear-cut cases that need hospitalization. For patients that are at home, as you've heard, 80% of patients with this do not need to be in the hospital. So many hospitals across the state are setting up screening tools, typically either by phone or virtual health. We're trying to keep these patients out of our buildings so that they aren't infecting our staff, aren't infecting other patients that are there. We don't want each one of these patients, when they're ill, to go to the emergency department. That's not the right answer. So call your provider, whether it's a doctor, a nurse practitioner, a physician assistant. Call them and talk to them about what to do. Many hospitals have set up call centers that are actually supporting those providers, because obviously getting tens of thousands of healthcare providers to understand this at the level of detail that you need to is very difficult, especially when you're calling people in certain specialties that this is a little bit outside of what they normally do. So many hospitals are setting up call centers to support the providers that work at that hospital or in that community so that we can assess patients by phone and determine the best next step. That next step might be go to the emergency room. That next step might be, I think this might be a cold. You probably don't even need tested. And then there's a group in the middle that are either high risk, that if say the elderly, as you heard, immune compromised, people with lung disease, if they were to have it, it's important for them to know. So high risk patients would be a criteria for testing. And then those with kind of moderate illness, cough, shortness of breath, things that are beyond what you would call a cold type symptom. And many hospitals are working out ways to test those people, but it requires a physician order. So that the term drive-through testing, I think we need to get away from using. It's not like driving through a drive-through at a fast food restaurant, ordering what you want and driving away. It's a provider-driven thing. You need an order for it. And then what we're doing is doing them in sites and locations to reduce risk to other people, including our providers. So it might be out at the curb that you're doing that. It might be in a parking lot in Seattle. They're doing these in a parking garage where they actually have people pulling through and they're swabbing them in their cars.
Do you think that's going to happen in Ohio anyway?
The parking garage?
The parking garage, the curb?
It's happening now.
It's happening now. Where is it happening?
A variety of hospitals across the state are doing this.
In Northeast Ohio, when we have all of our cases out of there, are they more at risk, Dr. Upton?
Laura, in what way would they be more at risk?
Because there's community spread in Northeast Ohio. There hasn't
Yeah.
been documented community spread in the other parts of the state.
Yeah, I would assume that all parts of the state, there's potential community spread going on now, just from what we're seeing and the amount of travel we've seen. And so, yeah, I do apologize if I gave the sense. It's really important that not everyone needs tested, and doctors and nurses and nurse practitioners are going to be ruling out other common causes of these symptoms of diseases. We have a heavy flu season going on. Remember that. And we have, all the ordinary colds and things that we catch. So they'll rule that out. They'll take a history. Have you traveled? I mean, we have people who are traveled returning. And so those folks with a risk factor or being exposed to someone who has COVID, and our contacts are the people who will rise up for priority testing. So you must have an order to be tested. And then these more convenient ways, what they're doing is they're trying to spare healthcare workers from the accidental exposure. And I do think that's more at risk in smaller hospitals. So there's a lot going on with hospitals to train them up on how to handle this. It's been going on all along. But as we all know, when it's happening is when you really need reminded. And that's what Dr. Thomas was referring to.
Thanks, everyone.
Can you answer
Thank
the
you.
question whether or not there's any concern about lack of protective gear for nurses and doctors in hospitals? You have it now.
I'd be happy to take that question. Every hospital, I would say, in the state of Ohio, if not in the United States, is taking the appropriate steps, I would hope, to manage their inventory of what's called personal protective equipment, or PPE. So we get a daily report of our number of both routine surgical masks that we have in stock, the N95 respirator masks, as well as gowns, gloves, and other personal protective equipment. It's one of the key parts of all of this work. So we've taken steps both to limit what I wouldn't call inappropriate use, but excessive use of that by staff. So if you can do 3 things in the room at one time with a patient, do all 3 together instead of making 3 trips into the room where you need to put on and take off protective equipment.
Thank you very much.
Let me add one thing. I may have misled someone. I'm playing back 45 minutes ago. I was asked the specific question about the NCAA and the play-in. What I meant to say, if I didn't, is that we do not, the order will be that there cannot be spectators there. There certainly will be people, there will be TV people, there can be radio people there, there can be sports writers, there certainly can be the media there, but we're not going to have the large crowd. So I don't know if I specified that or not. Thank you.
Thank you, Seth.